Thank you so much. I just wanted to come back to the issue that you were talking around the funding and what PIP was used on. And you said about the 1 in 2 people with mental health diagnoses quite often are using it for private medical expenses. And I'm guesting this morning from the Health and Social Care Select Committee. So I'm just interested in your take on where you think mental health services could and should improve to start addressing this problem. You've talked about the other end, where we're getting people back into work, rightly so, fantastic, all the things need to happen. But in terms of the mental health system, I just wondered if you could talk about how the funding you think might be there to help within the 10-year strategy that's coming forward.
Yeah, I think what I'd say about mental health strategy on a policy point of view, first off, is that it can't just be done through the Department for Health. We need a cross-government, cross-departmental approach. Luciana Berger, now Baroness Berger, did a lot of work on this before the new government came in, and we submitted evidence and did a whole look into how a cross-government plan could work, which we haven't seen published yet, and we'd really like to see the results of that. But ultimately, you need to be looking at prevention and trying to kind of wire in interventions early in schools, through employment. And it's a bit like with physical health, you have, yes, the NHS is there, but also you have PE lessons in schools and nutrition on menus and things that are designed across the system with your health in mind, and that infrastructure is not really in place for mental health. So that's one thing. We really want there to be a cross-departmental plan. Also, the other thing I mentioned already is the waiting lists side of things is still really bad. And the mental health investment standard, I'm not going to try and get too down this tangent, but does ring fence some money. So some of the money is already there. It just needs the system to be directing that towards targets in mental health waiting lists. I think that would be a really important move that the government could do it without committing much additional resource.
Thank you.
If I could add to that, if that's okay, just to say that it's not just the mental health system, there's also the social care system. In the mental health system, it's very much focused on recovery, which is one thing, but there are people who have or may always have those ongoing support needs. And unless you're able to access that through the social care system, you won't get that unless you've got PIP to pay for it yourself. The mental health system doesn't provide that form of support.
Dr. Becky Cooper wants to come in here as well.
Thank you so much, Chair. I just wanted to ask a little bit more about the data and what you're seeing about people who are in work and people who are out of work. So, and I know, Professor Barr, you've talked about inequalities and the disparities sort of perhaps geographically, but people who are in work across the mental and physical health spectrum, do they generally display better levels of physical and mental health compared to people out of work? And because the premise of the Green Paper is all about sort of putting down the barriers that might sort of come up against people who are trying to get into work. And if there are disparities there, could you explain them? And also people in work, are there different types of work? We talk about good work. So perhaps you might tell us about what that is and how we sort of perhaps can try and encourage that good work and what demonstrable benefits that has to health. That's probably quite a lot, so let me know how you pick it. I don't know if David, do you want to go first? Yeah.
I think one of the things we've got to look at is it's about helping people to manage conditions. So good quality employment support, good work being good for health can help people to manage the conditions that they have. You know, it's very rare that like an employment support service would be able to support somebody to become healthier to a condition where they're not having to manage that condition. So that's one of the key things that we're looking at. And the prevention approach obviously means that people can not develop co-issues such as like mental health conditions if they're experiencing something like a musculoskeletal condition at the start. And that's why we're trying to intervene early to prevent those issues from becoming worse. I think that perhaps the start of the conversation is very much around prevention, and if you're catching people at a later point and supporting them then it's really about helping them to manage their condition and find work if it's accessible to them that will help them, you know, in very much a person-led way to support them with that condition.
Thank you.
Yeah, I mean, I think it's such a really good question about whether the people's health is better in work or not. I mean, I think, and it's partly the surveys we have access to that tell us about this. You have kind of work limiting or not condition, and then a type of condition underneath it. You don't really get severity. I suppose what we would think is that if someone is reporting a similar condition but is unable to work, then it would suggest that the people kind of out of work have a more severe condition, I think. But where that, I think, is probably not always going to be true is about kind of labour market opportunities as well. So I think some work, other work we've funded as well with the Learning and Work Institute kind of points towards it's about the types of work that are available in different areas that people can do, which would play a different role. So, and I think also then the duration that people may have been out of work will compound some of the health conditions. So it's not purely about the health condition, and these things will change over time and potentially will be worse. But people may have started from a very similar position, but then had a different kind of paths from that point. I think on the quality of work, I mean, there's good evidence to show that people's health can actually be made worse if the work is wrong than if they remain unemployed, if it's poor quality work. So the quality of the work is really important. I suppose a lot of discussions will tend to focus around kind of insecurity, kind of zero-hour contracts, that type of employment. But I think it's also important that people have control within their work. It's also another kind of key elements, that kind of autonomy and control in the work that people do. So that doesn't mean you can't have effectively lower paid work that provides some of those things as well as stability and kind of structure in the day-to-day life. So it's not purely about, I think, everyone getting very high paid jobs. It's making sure that the jobs that are available provide the kind of appropriate levels of I think structure and stability and security for people when they're moving into work. And I think one thing, a final thing that we have tended to notice is particularly some of the areas where you're getting, I suppose, more pressure on people's health for people who are in work at the moment have tended to be in some public service areas, so places like education, the healthcare sector, where I think where the data would suggest people are increasingly under strain. And I imagine from the resources available, and that is playing out in people reporting kind of worse mental health rather than, I think, on the physical health side.
Thank you, that's so useful. I don't, Ben or Lucy, over to you.
I'm just briefly going to add the importance of not just looking at averages and saying, yeah, but this idea of good work is just, I just don't think it's meaningful to say whether work is good or bad. Same with education, like on average it's probably better to be in school, but there are some young people that school is incredibly stressful and the source of their problems. So I think it's great to hear that, yeah, the idea that you're distinguishing, there might be characteristics that you can predict which dictate whether a job is good or not. And I suppose that varies massively depending on the nature of the job and the nature of the disability and all sorts of factors.
Yeah. So yeah, I mean the relationship between employment and health is really complex, and obviously you've got people's health affecting their employment and their employment affecting their health in both directions, some work being good for people's health and other work potentially damaging. I think the only thing that I'd really add is that to support people into work with health problems does require good employment support, but it also the geographical pattern of people being out of work for their health is very clustered in particular places. It also requires developing kind of economic growth in those places that's actually going to be inclusive of those people and develop jobs in those places that's going to help people with health problems move into those jobs. And there is a lot of emphasis on sort of economic growth, and we've done some work with Preston where they've had a kind of inclusive economic strategy and found they had a big effect on employment, but their effect on employment of people with disabilities was 5 times greater than on non-disabled people. So there is a role for inclusive economic growth strategies as part of strategies to try and improve outcomes for disabled people.
Thank you. Thanks.
Very quick one.